Bedwetting is always unpleasant, but it's definitely not uncommon. In the US, 1 in 5 children under the age of 8 regularly wet the bed. So if this is happening to your child, you're definitely not alone. It can also add a lot of stress to your family or your child's life and cause a great deal of embarrassment for them. It can even harm their social interactions if they begin to lose self-esteem when they can't join in with friends during sleepovers or camping trips. But what are the causes of your child's bedwetting? And more importantly, how do you help them stop? If you haven't already, please consider subscribing to Snooze Insider and click on the bell icon to get notified for our latest videos. Information on everything we've talked about will be in the description below. There are many potential causes of bedwetting, so let's explore a few of them. According to some studies, bedwetting may often be genetic. 75% of children who wet the bed have a parent or another immediate family member who also wet the bed as a child. Scientists don't know exactly why this is true, but it does mean that you can rest easy, knowing that your child will probably grow out of it. The development of your child's body may be another cause. The bladder is a muscle which you need to learn to control, much like learning to walk or write. So, their bladder might simply be underdeveloped. It could also be true that the nerves which tell their brain that they need to pee might also not have fully developed yet. Stress is another leading cause of bedwetting. Any kind of stress can cause this problem, whether it's fighting parents, moving houses, or bullying at school. In this case, a child therapist might help. It's also possible that your child might have a medical condition that is causing them to wet the bed. Some of these conditions include urinary tract infections, sleep apnea, anatomic or nervous system problems, or chronic constipation. Children with ADHD are also more likely to wet the bed. Researchers think it may be linked to a delay in the development of the central nervous system. If your child has been dry at night for more than 6 months and suddenly starts wetting the bed again, it can be an early sign of diabetes, especially in cases where there aren't obvious emotional stressors that may have caused it. If you suspect your child has any of these problems, it's important you make an appointment with your GP. But if there aren't medical causes, that's a good thing. You can definitely help your child drain their bladder, even if it might take some time. The most important thing is to never blame, belittle, or embarrass your child. It's not their fault, and yelling at them will only make the problem worse. Make sure you don't talk about their problem in front of people to minimize their anxiety and embarrassment, and don't allow any teasing from siblings or other children. It's also helpful to limit the problem by planning for a cleanup, using a protective cover on their mattress, keeping clean bedding, and a change of pajamas nearby. You may also have them put on absorbent underpants when they go to bed. It's important to reduce their anxiety, and yours, as much as possible, and these techniques will help. At the same time, you can start to help train your child's bladder. The first step is making sure they drink enough water. This helps them to learn bladder control. Make sure they drink enough after they wake up and throughout the day, but limit their intake after dinner and before bed. Make sure you're not giving them any drinks containing caffeine because it stimulates the bladder, and yes, that includes sodas. Training your bladder often starts during the day. Teaching them to go every 2 hours is usually good practice. Many children stop peeing when they don't feel the urge anymore instead of emptying their bladder completely. A good technique is to teach them to pee twice. This is where you teach them to sit down to pee. When they think they're done, they can stand up as usual, but then have them sit back down and try to pee again. It is important to have boys sit down to pee as well because they don't often relax their pelvic muscles properly if they pee standing up, and this stops them from fully emptying out their bladder. Rewarding dry nights is another technique which seems to help. Try tracking their success with a sticker on a calendar every time they don't wet the bed, and giving them a big reward which they can ask for once they have a certain number of stickers on their calendar. Verbal praise is important too. This keeps their self-esteem high so they can have the confidence they need to conquer this issue. Bedwetting alarms may also be an effective treatment for your child. With these alarms, special moisture sensors are placed close to or in the child's pajamas. The device will buzz when it detects any sort of moisture. These are designed to train their bodies to wake up when they need to go. Most often, when you first start using these devices, it is the parents that are awakened by the alarms and needs to get the child up to use the bathroom. However, with continuous use, your child should be able to wake up on their own to the buzzing alarm within 4 to 6 weeks. In most cases, children will be able to get up on their own to use the bathroom or hold in their urine until the morning within 12 weeks. Once your child is able to wake up dry for 5 weeks straight, they can stop using the bedwetting alarm. If your child begins to wet the bed again, you can repeat the process. In some cases, doctors may prescribe medication for bedwetting, although there may be some side effects. Most importantly, don't panic. Most children stop wetting the bed without any intervention as they get older. It is a very common problem and often isn't much to worry about, even if it is a bit inconvenient. Using these techniques can help your child stay dry faster, but the problem should go away in no time. Have you got a good tip for dealing with bedwetting? Let us know in the comments below. If you've enjoyed this video, please be sure to give it a thumbs up so we can continue making them. Don't forget to hit the subscribe button and remember to click on the bell notification. Share this with a friend if you think they may need a little wake-up call. Thanks for watching and see you next time. Until then, sleep well.